Ladies and gentlemen, Dr. Leo is here from the Health and Wellness Pod. Now, what destroys your kidneys? Do you ever ask yourself that question? A lot of you, a good number of people are actually managing or treating kidney failure through dialysis, or some of you are awaiting a transplant. Some of you are nursing parents who are actually going through this, and it's an unfortunate situation. However, there's always something you can do. I always tell you, you are never late for healthcare, so do not despair. Now, what destroys your kidneys so that you can actually have the information to prevent, and if there's an occurrence of the kidney disease, you can actually now start the process of reversing that. Okay. Now, chronic kidney disease, which is also known as the chronic kidney failure, is basically a destruction of nephrons. In the kidneys, we have cells that are called nephrons. Their role is to filter blood, their role is to reabsorb minerals and ions, and their role is also to excrete excess of these ions in urine so that you don't end up having excess or low of these electrolytes. That's the function of the kidney. And through these nephrons, the kidneys perform their role. Okay, so through these nephrons, they actually enhance the function of the kidney. So without nephrons, the kidneys cannot function normally. All right. Now, some of the things, maybe just as a highlight of the functions of the kidneys, we've already said this multiple times. They are wet bed. All right. So acid and base balance for A, water balance for W, electrolyte balance, and then toxins excretion and balance, which basically the toxins or the metabolites of proteins, the urea, the creatinine, all these things are balanced by the kidneys. If you have a dysfunctional kidney, of course, they start building up, causing you more problems. Blood pressure regulation, all right? EPO. EPO is erythropoietin, which basically is the hormone that instructs the bone marrow to produce more red blood cells so that you don't go into anemia. And of course, the same kidneys activate vitamin D to actually make sure your immune system is up and your bones are of high density to support your skeletal system generally. So those are some of the actually those are the functions of the kidneys. And if the nephrons are being destroyed, these functions are being now altered, and you'll end up having problems. For example, if you end up having kidney problems, you expect not to be able to excrete a lot of the toxins that are coming in as a result of metabolism of proteins. Therefore, you start having the nausea because the urea is going up. Since urea is going up, nausea is coming in, vomiting is coming in. There's a condition called encephalopathy, where you start experiencing these conditions, these psychotic symptoms, and can actually lead to death and liver problems. Okay, we have now impaired clotting because, again, you cannot develop the clotting factors, and the kidneys are actually involved in calcium reabsorption, which is very important in the clotting. If you have high potassium because you're unable to excrete potassium, arrhythmias are coming in, the abnormal heart rhythms. If you have now kidney problems, high blood pressure is coming in as a result of the activation of the RAS system. You have weak bones because you cannot produce vitamin D enough. You cannot reabsorb phosphorus and calcium from the kidneys. And now you have weak bones. Anemia is coming in because of deficiency of the erythropoietin. Acidosis or even alkalosis, they are always coming in because the kidney regulates acid and base functional balance. And then high sodium and high chloride levels are going to cause you to retention of water, which is going to cause you edema. And some of you wake up with a lot of puffy eyes. Some of you wake up with this edema in the legs. When you're traveling, there's so much edema in your leg, you should actually start checking your kidneys and your blood sugars. And kidney edema, edema caused by kidney failure, is called pitting edema, where you can actually press in and you now have a hole. It doesn't come back just like the normal one. So there's that hole that forms when you press in deeply and then comes and fills up slowly. That's pitting edema, a symptom of kidney failure. So all these things are coming in because you're just failing your kidneys. And of course, the things that actually fail the kidneys are the reasons for this video. So I'll go straight into it. Number one, the number one cause of kidney failure is diabetes. And then you want to tell me that you want to treat kidney failure independently, you want to treat hypertension independently, you want to treat cancer independently, you want to treat strokes, you want to treat heart attacks independently, including dementia, when we all know that the mothers of all this is actually lying in sugars. Diabetes is a menace, is a crazy world, and actually can take you out so fast. It can take you out in any form. It doesn't have to be the diabetes. It can take you out in any form be it a heart attack, be it a stroke, be it a kidney failure, all these things are actually now linked to diabetes. So you start being cautious about those sugars in your system. So diabetes destroys the kidneys totally. It's actually called diabetic nephropathy, destruction of the nephrons as a result of sugar. Number two, of course, all the ones that I'll be talking about, most of them are actually linked to one thing, and that thing is insulin resistance, including diabetes. All of them are linked to insulin resistance, where you have higher insulin in the system that is not being effective on the cells, and then we end up having high glucose in the blood, and now problems start coming in as a result of that high glucose in blood. So high insulin levels will cause water retention, because remember, when you have high insulin, you retain water. This is one of the reasons why your doctor will lie to you that salt is the cause of hypertension, when the same doctor understands that the cause of water retention in the kidneys is insulin resistance. So how is salt involved in insulin resistance? A question that should totally be taken seriously. All right. Once you ask that doctor that question, they'll start becoming angry because they don't like being challenged. Ego comes in. That is that's time for you to change the doctor. Okay. So insulin resistance causes water retention, and water retention increases blood volume. Blood volume increases blood pressure, and now this blood pressure, the increasing blood pressure, can now cause a direct effect on the kidneys. That's rupturing the blood vessels in the kidneys, and also the sugars are causing a lot of problems with the kidneys. So this one is a double tragedy. The hypertension and the glucose that is high in blood, all of them are going to cause a degenerative kidney. All right. So be cautious about that. Number three cause of kidney problems is, of course, now uncontrolled hypertension. Just the same way we've just explained the insulin resistance, because that is the mother to everything. Insulin resistance is the mother to diabetes, obesity, kidney failure, hypertension. So you can see all of them are linked to insulin resistance, which basically tells you the major cause of the kidney failure is insulin resistance. All right. It just divides into different things. Like, for example, the drugs and all that, cigarette smoking, which we'll talk about, they are just others. But the major one is the sugars and insulin resistance. All right. Okay. And this has nothing to do with genes. Kidney failure has nothing to do with the genes. It has everything to do with what you're eating, because you have to turn on the genes through something, and that thing that turns on the genes is called epigenetics, which we're actually talking about. Now, number four causes of kidney problems is drugs and medicines. Let's just call them medicines or medications. The non-steroidal anti-inflammatory drugs, these drugs that you people use all the time, over-the-counter medication for pain, pain that is caused by arthritis, pain that is caused by menses, pain that is caused by just an injury. Now, I'm not saying that if you use ibuprofen or diclofenac or meloxicam or aceclofenac or celecoxib, these painkillers that you use, the likes of Zulu and all that. So I'm not saying these drugs are going to cause you kidney failure directly. I'm saying excessive use of this medication, because there are some of you who experience a migraine every single day, and you go ahead and buy this medication on over the counter every day. There are people who have arthritis and they live with the pain every single day, and they take this medication. There are people who have menstrual pain every single month, and they're taking high doses of this medication every month. Those are the people that I'm saying you're going to expose yourself to these problems. So non-steroidal anti-inflammatory drugs, steroids, people in the gym who are injecting steroids, they know very well this is going to hurt them. People who are actually taking the dexamethasones, the prednisolone, these drugs that are used for either chronic pain management, either high stress in the system in terms of arthritis, either asthma, either inflammatory bowel syndrome, these long inflammatory conditions, the chronic inflammatory conditions that require you to use a steroid. Long-term consumption of steroid will mess up your gut, it will increase your blood sugars, it will increase your cortisol levels, and then it will increase now your chances of a kidney failure. All right, so stop. If any case, there's a gland on top of the kidneys that is called the adrenal gland, very responsible for production of natural steroids. So the more you're using steroids from external sources, you're going to shut down that gland and you'll get into problems. So avoid these steroids. If you can use them for a short period of time and then taper them down so that your system takes over to actually recover. Other medications like antibiotics, like the vancomycin, there's an antibiotic that you people abuse all the time when you're going to hospital and you're being diagnosed with resistant typhoid, you're being diagnosed with urinary tract infections and brucellosis. Okay, the diagnosis of brucellosis, they give you gentamicin injection for 21 days. My friend, gentamicin is very dangerous to the ear and is also dangerous to the kidneys. Avoid those misuse of antibiotics all the time, all right? And nowadays, there are drugs that are reserved, like the vancomycin. But you people have actually abused ceftriaxone so much that now the only option that you're having is either the imipenem or the vancomycins. And these are drugs that are very dangerous to the kidneys. In the northern region of Kenya, we have all these conditions that are called the 𝐊𝐢𝐝𝐲, leishmaniasis, where they use paramomycin or they use sodium stibogluconate. Those are medications that are very dangerous to the liver and to the kidneys, all right? And then, of course, drugs for abuse, cigarette smoking, cocaine, heroin. These are drugs that destroy the kidneys. Some anti-cancers also come in handy in terms. Actually, most anti-cancers destroy the kidneys. Some of the anti-HIV medications, they destroy the kidneys. But for drug abuse, cigarette smoking, cocaine, heroin, tramadol, people who abuse this medication so much, even doctors abuse these medications so much. And tobacco is actually known to cause problems with oxidative stress in the kidney cells. So avoid tobacco in all forms, right? Avoid tobacco in all. I'm not just saying cigarette smoking. Avoid tobacco in all forms because of the formation of oxidative species or radicals that actually cause inflammation in the kidneys. Also avoid alcohol. Dehydration is coming in with alcohol. Alcohol raises your blood sugars. Alcohol causes problems in the liver, the fatty liver that causes kidney failure. Alcohol hurts your kidneys directly. Alcohol hurts the pancreas. Alcohol hurts the gut. All these cumulatively bring in a problem in terms of the kidney problems. And very rarely will you have kidney problems without having liver problems, because these two organs function hand in hand to protect you. So it's time for you to protect them so that they can actually protect you. Now, there are myths, of course, around these kidney problems. And the myths, of course, you've heard salt can cause you hypertension, salt can cause you kidney failure, is a lie. Salt has no role in causing insulin resistance. Sugar is the problem. Also, run away from the lie that, you know what, if you consume high protein diet, animal protein diets, you will end up having kidney problems. That is not true. The truth is, if you consume lean meat, you end up converting it into glucose, and glucose can affect your kidneys. Fatty meats cannot, because you will not overconsume fatty meats, all right? Number two, metabolism of these amino acids can yield uric acid, because proteins are metabolized to the urea and all that. And that urea, not uric acid, sorry, the urea. This urea can be toxic if you have a problem with the kidneys already. It's not because, it's not the red meat or the urea that is coming from that destroys the kidneys. No, it is the accumulation of urea as a result of kidney failure, which is caused by insulin resistance, which is sugars, okay? You also heard of saturated fats causing problems? No. Enjoy saturated fats, use them for cooking, whether deep frying or shallow frying, do not care. Enjoy the ghee, the tallow, the lard, the sweat, the olive oils, but do not use olive oil for cooking. Enjoy the omega-3 fatty acids, like the cod liver oil, all right? Enjoy them in plenty. Now, also, another misconception that coffee or caffeine hurts your kidneys. I'm yet to come across a research that actually confirms that. That is not true. So enjoy your coffee. But before you take that coffee, take water plus some salt. And then now you can enjoy your coffee to protect yourself from dehydration. So those are the myths and those are the causes of kidney failure. When you have information, you know how to prevent yourself. You even know how to actually come out of that menace that you're already in. Reverse the sugars, reverse kidney issues. I thought you should know.